critical
治愈出
conditions
院
and
80人。
125
在医
deaths.
疗救治方面，
80
我们采取
discharged.
了以下措施：
In terms of
一
treatment,
是努力使
here are
群
the
众
methods
有
that
地方
we
看
have
病；
taken. First is to make sure that
一是及
all
时
of
接
the
诊发热病人。
public,
549
all the people
家
have access
2级医疗
to
机构
this hospital
发热门诊来接
and
受发热
medical
病人。
care.
2级以
Altogether,
上医疗机构严格
594
规范设置发热
medical
门诊，
institutions open up a fever clinic,
乡镇卫生院和
and
社区卫
they are
生服务
working
中
around the
心
clock.
是专门对接发热病人的诊所。
The community medical center and clinic also
严格实
open
行预
up,
检分级，
and
对发热
there
病
are
人
medical
分类
staff
隔离留管
standing by and make a timely assessment
确定
of
重点
the
医
fever
院
patient.
就是患者
And second,
全
we
省
have
更确定
designated the
了
hospitals
131家定点
as
医院
key
收拾
places
新
to
型冠
treat
状病毒
and
感
cure
染
the
的病人
patients.
疑似和确诊病例，其中武汉确定了30家，其他4
In
州
Wuhan, there are 30 designated hospitals,
3是加快
and there are another 110
目前
hospitals
全
are
省
located
开设
in
隔离
other
病房
cities of
1.1 万
Hubei province. Currently,
其
we
中
have
武汉
opened
开设
up
的隔离床是
quarantine
5000张，其他4州
hospital wards that amounts to 11,000. In Wuhan, there are altogether 5,000 and 6,000 for the other regions combined. We also make renovation of the existing hospital wards in order to better meet the
我省
demand.
的医务工
The
作
second is to make sure that all of the patients can have access to the
各类的医疗机构
doctors, and
放弃休假，
all of the medical staff in our province have given up their holidays and resumed their positions in their hospital. Altogether, more than 80,000 medical professionals have participated in this prevention, control, and treatment methods.
医务人员超过
And they're working at the front line, and altogether the medical staff exceeds 170,000.
国家中药管理
And as of last night, we have medical staff coming from all over the country, from 29 provinces and autonomous regions and cities. Altogether, more than 60,000 medical staff
其中41
participate and join us in our endeavors. 41 of the the medical teams work in Wuhan, and the rest are in Jingzhou, Xiaogan, Xianing, Xiantao, Xianjiang, Tianmen, and other 11 counties. We also have PLA support
上海、北京、
in 广东、浙江、上海、广东、浙江、河北、湖南、山东、北京、天津、重庆, and other 12 cities all send multiple medical teams in our assistance. Third, we pull all endeavors to treat the patient. According to the guidelines, based on the guidelines, we pull our resources and expertise together in order to treat the confirmed cases as well as suspected cases. And we make individual plan for each of the patient. We also lead the patients to seek medical help in a more proper way.
开始了线上咨询，
Multiple hospitals in our province have opened up online clinics providing consultation for the patients, and also we have conducted education and campaign online. And second is
经过
to
专门培训的医务人员负责
arrange professional and
对筛出来的
capable medical staff at a grassroots level.
进一步确诊。
And once a fever patient is found, we will lead them to hospitals of upper level to receive more appropriate treatment.
机构和从卫生
Third, the community level clinics as well as medical institutions are an important function, an important branch to the collective prevention and control. This kind of grid prevention and control methods are proven to be effective in terms of the control of this disease. Thank you, Madam Liu. Now the floor is open to questions. Please identify yourself before asking a question. With CCTV, my question is, as far as we know, we are experiencing a short supply in terms of medical materials. We saw a lot of calling for help online. And what kind of measures will we be taking to address this shortage of materials? Good evening. It's great to meet you again. I want to thank you for your question first. Before taking your question, I have some additional comment to make. Since the outbreak, we heard a lot of criticisms of our policies, some of them very harsh. I fully understand that this is good medicine that takes bitter. They meant to urge us to do our work well. I want to express my sincere gratitude for your criticism and supervision of our work. I want you to continue your criticism and supervision of our work. We are all in this fight together. Currently, the prevention and control of the epidemic in Hubei province is at a critical point. After our careful research at the commanding center, the holiday of Hubei province, the comeback time for the factories will be no later than February the 13th, and all of the schools and universities in province must delay their inauguration day, and the exact date will have to be further discussed depending on the situation of prevention control of this epidemic. But I fully believe that with the strong leadership of a Central Party Committee with Comrade Xi Jinping at its core, and with the support of the Central Special Leading Group and the strong support of the whole nation, we are in every place. We are in a very good place to win this battle, and no difficulties can stand in our way. To answer your question, in terms of medical materials, it is the weapon of our medical staff. You cannot possibly win a fight without proper weapons. Currently, we are truly under this shortage of supply, not only in Wuhan, but in surrounding cities as well. there is an undersupply in terms of medical resources. In order to make up for this gap, it is crucial for us to do it because it's a race against time. The central government is deploying resources from all over the country and prioritize the deployment and prioritize Hubei as the receiving end of all of these resources. On the 27th, Premier Li Keqiang visited Hubei, bring with him the important instructions of the Central Party Committee and General Secretary Xi Jinping. We have received a lot of donation, and all of them are right now being put into the right place. The provincial committee is also organizing the enterprises within Hubei to speed up their production. And the 26th, I went to Xiantao to supervise the work. The chairman of the board of one of the companies there rushed back to her hometown and began organizing production. And she said to me, if we can produce one more protection suit, we could save the life of save one life. I was deeply touched by her words. The shortage of medical resources will continue to exist in a short period of time. However, with the stronger support of the central government and with a synergy of all walks of life, I believe that this difficulty will be resolved soon. Also, with unified allocation, careful management, and scientific deployment, we can guarantee that a sustained supply of medical materials. With Renmin Daily, right now all of the cities have confirmed cases. So how do you strengthen your work in other cities, in cities other than Wuhan? Thank you for that question. It is a very targeted question. Wuhan has always been the epicenter and the most important battle that we have to win in fighting this epidemic. However, in all of these surrounding cities in Hubei, confirmed cases were reported, which alarms us that faced with this epidemic and in the process of prevention control, we have to do a comprehensive motivation and comprehensive deployment. We need to prioritize. At the same time, we have to strengthen prevention control in other cities as well, so that the whole province can form a synergy of prevention and control together. In the other cities, the priority is to find the key region and key groups of people. Right now, Huanggang, Xiaogan, Jingmen, Xianning are facing quite severe conditions, especially in Huanggang. The number of confirmed cases and suspected cases have exceeded 1,000 in combination. We will not allow Huanggang to become the second Wuhan. That's why the provincial commission have sent a special working group to Huanggang. We also have sent supervision team to other cities. So early detection, early discovery, early quarantine, and early treatment are still our utmost important weapon to fight this disease. These are proven to be useful methods. On top of that, community, village medical clinic, and village doctors must play a bigger role to conduct grid management. So this kind of on-site screening and treatment as well as quarantine is crucial. Right now, the lack of medical human resources is one of the most prominent problems that we are facing. In these four regions, we have been expanded the medical institutions, and more than 8,000 beds have been added. As of 11 p.m. yesterday, Huanggang's version of Xiaotangshan Hospital began to operate and admit patients. As of 5 p.m. today, 11 medical teams and more than 1,500 medical professionals joined the workforce of the cities other than Wuhan, because they are considered the weak link in terms of human resources. To curb the spread of the disease in rural areas, it is crucial to control the flotation of population. For the returnees, we have to do the screening one by one, to register one by one, so as to have a clearer knowledge of their whereabouts. And no one is left behind, no corner is left behind. This is the first barrier to fight against this disease. The rural areas has a vast region, so implementation at the grassroots level is of paramount importance. Wherever you are, as long as you are a party member and a cadre, you have to stick to your position and fulfill your duties to win this battle. The medical professionals are the main power to win this battle. But right now, in most hospitals, there is an understaffed situation, and the panic of the patient also add to the pressure of the medical staff. So what measures have you taken to protect the interest and health conditions of our medical workers? We always call the medical staff the strongest workforce and the bravest men, bravest people, because they are at the front line of fighting this disease. They are truly the hero of our time. I also would like to take this opportunity to extend my utmost sincere gratification to our medical professionals. Thank you very much. The medical staff are always at the front line of fighting the epidemic. We have to try our best to protect their safety. Masks, protection suits, and along with other medical resources should be sent to the front line as the first and foremost priority. They are working under unimaginable pressure. I also visited several hospitals myself, Renmin Hospital, Zhongnan Hospital, Tongji Hospital, and so on. I heard medical professionals talking to me, saying that they are sweating underneath the protection gear. Some of them are working more than 10 hours a day. So you can imagine how tired are they. And so we have established a well-established rotation system. We also have organized nearby hotels and arranged vehicles so as to ensure better accommodation, make sure that they eat well and sleep well. The fever clinic of many cities are overcrowded, so we have put the patients into different categories. Those with light syndrome can stay at home to recover and seek medical advice online in order to reduce the pressure of our frontline medical workers. I think to treat them well is to treat life well. We will also be giving them subsidies, working subsidies. And make sure that to create a favorable conditions for them so that none of their efforts will be paid in vain. We will do our utmost endeavor to ensure that their family members are taken care of. And if their family members have problems, we have a special personnel there to answer their need. Many of them actually volunteer to do the work. And they come to their position regardless of the cost or even regardless of life and death. For example, Dr. Guo Qing in Zhongnan Hospital, he was actually infected. After he was cured, he went back to the front line to continue the fight. Dr. Cai Tao and Liu Fang from the provincial 3rd hospital are a couple that fight alongside each other. There are many stories like this. They are all our heroes. We must take care of them like we take care of our families. With Hubei TV, my question is, there is an increasing number of fever patients and there's a shortage of hospital beds. Are there any solutions to that? We have, of course, a large number of fever patients, But the peak happened in the 23rd, a total amount of 40,000. And yesterday, the number was reduced to about 30,000, but we still need to increase the number of beds. And in 2 days, 19 more hospitals open up fever clinic in Xianing and Xiaogan. On top of the designated hospital, they also have backup hospitals. There's an important number that I need to correct. Um, 100,000 beds in 112 hospitals were allocated to cure the fever patient. It is not to say that all of these hospital beds in these 112 hospitals were allocated to cure the patients. We are right now building 2 new hospitals, Huoshenshan and Leishenshan. But once they are finished, 2,000 more beds will be provided. In Dabieshan, we will be building another hospital with more than 1,000 beds. Not all the existing wards can be directly used to treat infectious patients. Otherwise, our medical staff and patients in other departments will have the risk of being infected. So we have to do some modification and renovation of the existing wards if we want to use them as infection ward.
您好，我是新华社记者，我有个问题想请问一下。
With Xinhua News Agency,
目前的疫情汇总来看，
the question goes to Madam Liu.
新型冠状病毒肺炎的确诊。
Currently, there are still a large number of suspected cases.
省卫健委采取了哪些？
So it's important to speed up the diagnosis process. And are the diagnostic kits enough?
在这个新型冠毒在确诊之前叫不明原因肺炎，其实真正确诊，国家能够对它。
Before it was diagnosed, we call it pneumonia of unknown reasons. And the first case was diagnosed on January the 11th at provincial CDC. Currently, 89 institutions are eligible to do the diagnosis. Provincial CDC and 3A hospitals, as well as third-party diagnostic institutions. So our capacity have been strengthened. If all of them are running in full capacity, they can diagnose 6,000 person share. Take example in Huanggang. At that time, it can only do 49 diagnoses a day, but after training, their efficiency of diagnosis have been improved. Right now, they can do about 400 a day. In the past, the diagnosis process is quite slow. But right now, the situation has been resolved. For 3A hospitals, you not only need to receive training, but also you need to guarantee safety and you have enough access. You have access to PCR. Second question: if the diagnostic kits are enough to meet the demand. As of yesterday, our resolve has amounted to 50,000 kits. And the second batch, if we add a second batch, the total number will amount to 110,000 kits. So we have to further shorten the time of diagnosis and make sure that all of the suspected cases can be diagnosed and receive timely treatment. So for Tier 1 hospitals, they still have to send the sample to these medical institutions, the level 3 hospital or CDC, and that might take longer time. So we have to make sure that the qualified hospital can play the leading role. And we also need to guarantee safety during the transportation of the samples. So we have to arrange special vehicle to do that.
好，下面接着提问。这位女士，请。先通报一下自己媒体机构的名称。
您好，我是中国
Please identify yourself.
问题我想提给
With China Daily,
教授。我们想了解一
this
下
question goes to Professor
在
Chen
这种大环境
Chen
下，
Zhenshun.
按隔离
So as common public, if you stay at home to do the quarantine, what are your suggestions for that? If you are doing home watch, it's mainly for those light syndrome patients and close contacts, because the main way of transmission is droplet. So we suggest that this person being quarantined need to stay alone in one room, and the quarantined person and the family members have to wear masks all the time. And timely sterilization is important. All of the utensils that is touched by this person need to be sterilized. Door handle, for example, or remote control. It can be effectively sterilized by alcohol of more than 75% concentration. Dry up the clothes after washing. Right now, the public are very concerned whether there's effective drug for the disease. What other drugs are proven useful? Currently, there is no targeted drug to treat this virus, the coronavirus. For light syndrome, we stress good rest and syndrome-targeted treatment. We still lack evidence as to which drugs are useful, and correlate is proven to be useful, but it still needs to be tested in terms of other drugs. We can recommend use antibiotics because this is a coronavirus infection, but we need to be extra careful when it comes to antibiotic usage. So we are now doing relatively simple treatment to the existing cases.
这位，还是
疫情发生之后呀，社会各界十分关心。
Since the outbreak of the epidemic,
那么我们想问一下，
a large quantity of medical resources were sent to Hubei. So are they allocated in a effective manner?
谢谢你的提问。
Are they fully utilized?
非常感谢社会各界的关心啊。
I want to thank the support from all walks of life
发放资源，
for your support and your aid to our province. Since the outbreak,
引阅向湖北援助物资。那么到
a lot of materials and medical resources were transported to Hubei in a timely manner. Our Red Cross system have altogether received about 4.2 billion RMB and 5.29 million
对湖北深情厚谊，
pieces of
体现了社会的大爱。
medical resources. This shows that the spirit of helping the compatriots out. So we deeply felt that the whole country is standing alongside with us. This has given us
信心和动力
confidence and motivation to win this battle against the epidemic. Hereby, on behalf of Hubei people,
表示衷心的
I'd like to extend my heartfelt thanks to all of the support that we have received so far.
这份关心。
The donation is an embodiment of your concern, so we have to use these donations well
物资都用在刀刃上，
so that they can be utilized in a most effective manner. So we have created 3 lists.
需求清单、
First is the list of demand, the list of reception,
单
and list of utilization.
需要什么，如何交
What do we need?
使用
How do we use them? And how do we move them? And how do we use
医
them?
疗物资，刚才我给大家介绍的很紧缺。现在医院
Of course, we are still under a short supply in terms of material resources. So the allocation of the resources has to be fast
那么
and
对定向
accurate.
的捐赠物资资金，
For the targeted donation,
充分的尊重捐赠方的意愿。
we have to respect the donors' wish to send them directly to the destination of the designated destination of donation.
实行一批次一调配，用在
So
最需
it's
要
one batch, one allocation.
援助物资使用，全程接受社会监督。
And the utilization of the resources are under social surveillance
我们承诺
at full spectrum, and it's totally transparent. Once malpractices are found, and we will carry out the most severe, most serious punishment. I also like to take this opportunity
因疫情滞留在外，回不来的
to extend my
滞留湖北
thanks to those Hubei people who
回不了
cannot go back to their hometown
下人员，
and those people who stay in Hubei and could not leave,
所有人员
and to all the people who are stuck at home.
感谢你们的支持，
Thank you for your support of our work and your
你们遭受的
cooperation.
困难，我
We
们
understand your difficulties, and we
你们
felt
的
your
牺
pains,
牲和付出，
your sacrifice,
我们远远
and
不可忘
your
湖北的人民
the payment that
远远
you've
不
made
可忘记。
will be remembered by us, and will be never forgotten by the Hubei people. I also would like
新
to
闻媒体
especially thank our friends from the media, our
不遗余力
journalists.
地为湖北鼓劲
You have spared no effort to cheer us up, to cheer Wuhan up.
冲锋在前的勇敢战士。
You are also the bravest warriors that is rushing to the front line. My highest tribute
好，
goes to all of you.
由于时间关系，今
Due
天
to
的
time
提
constraint,
问到此结束，
that's the end for today's presser.
也
I want
谢
to
谢
thank
各位
the
记者朋友。
speakers and
今天的发布会
thank
到此结束，
the
谢
friends
谢
from
大
the
家。
media for your attending.